if I'm on the outside, I can approximate the kind of force and the direction of force that I would use to move a vertebra or a pelvic structure or even an extremity bone in the foot. If the body does it itself, it uses the exact amount of force it needs, which is likely to be a lot less. And with the muscle testing to guide me, I feel a lot safer about it.
Hi, everybody. I'm Dr. Lisa Gordon of the Natural Health Improvement Center of Columbia, Maryland. And today I'm delighted to have my dear friend and mentor, Dr. Stuart Marmorstein, joining me on this conversation. I met Dr. Marmorstein we figured out around 2006 or so, when he was one of my instructors for a cranial technique that I learned way back then. And I always knew that I needed to keep in touch with him because there was going to be something that he was going to teach me someday. And he's had lots of different things that he's offered, and I've loved staying in touch with him, yet none of those things really motivated me to hop on a plane to Houston to learn those things. Yet when I found out about assisted self-alignment protocol, I was on the next plane. And so I wanted to introduce this method to you. Many of my patients have been benefiting from it. And I wanted just to tell you a little bit about Dr. Stuart. He has a thriving practice in Houston, and he's a master of applied kinesiology and many other methods, many of which he's developed himself. And he has patients coming from all over the world to see him, and sometimes they stay for a period of time to see him, many visits in a row. And when I say all over the world, I mean from other countries. I've heard of people from even India and lots of other places who come to see him and fly all the way to Houston because he's such a master and such a great healer. And I feel very honored and very blessed to be able to introduce Dr. Marmorstein to you. And I'll be calling him Dr. Stuart because that's what we call each other in chiropractic. We tend to call each other by our first names, Dr. So-and-so. So I'm Dr. Lisa, and this is Dr. Stuart. And Dr. Stuart, would you please tell us a little bit about yourself and how you came to develop this technique that we'll call ASAP, or Assisted Self-Alignment Protocol?
Sure, and thanks so much for having me. I became interested in chiropractic fairly late in life, mid-20s, and I was originally in a 5-year pre-medical medical program with Penn State and Jefferson Medical College, and thought that I was going to become an MD. But all along, I also had a premonition that this wasn't where I was going to ultimately end up. And on coming into contact with a few chiropractors, I became entranced by the philosophy of chiropractic, which is that the body is designed to be self-regulating and self-healing if we just get the blocks out of the way. And that led me to apply to chiropractic college, which I was accepted into and started in January of '76. Immediately upon arriving there, not having ever had a chiropractic adjustment myself, I found that there were people around who were doing this odd-looking thing called muscle testing or applied kinesiology, and they seemed to be getting some better than average results. So I became intrigued by that and started to learn it. The person who started applied kinesiology graduated from chiropractic college 40 years before I did. That's Dr. George Goodhart.
Sure.
And he passed a few years ago at the age of 90, but brilliant man. and always had a curious mind. And I think that attracted me, that he was exploring his whole life. And I think I've followed in his footsteps in that sense. One of the things that happened after I met him was I also met a mentor. I'm a person of many mentors, or several mentors. Dr. Goodhart was one of them. He introduced a way of finding out from the body and from the brain and from the consciousness that runs the body, which chiropractors often call innate intelligence, that you could use resistance muscle testing to find out what's misaligned in the body. And you could also use it for other things. You could find out if somebody needed some sort of an adjustment to their nutritional protocols, or find out if there were some sort of an emotional stress that was behind some of the troubles that were keeping them ill or in pain. I later met somebody named Dr. Richard Van Rumpt, who was a very good friend of mine for years. I met him in the early 80s, and he's the founder and developer of something called directional non-force technique. Unlike the people who were in my chiropractic college, Texas Chiropractic College in Pasadena, Texas, he was using a totally non-forceful method that involved using a thrust done through the thumbs. There was no noise associated with it. It did contain a cranial component, which Dr. Goodhart also thought was necessary. And people got great results there. Both of them also believed that muscle balance had a lot to do with whether or not we would be in good alignment and therefore functioning better. And then, as Dr. Lisa mentioned earlier, I ran into an osteopath from Ireland, Dr. Robert Boyd, in the very late 1990s, and ultimately became a teacher in that approach, which is called the biocranial system. It's recognized there that tension in a membrane that attaches to the inside of our skulls on one end and to the sacrum at the base of our spine on the other is very important. So the technique that I've developed is based on the pioneering work of these people and others who had special insights into why it would be possible to do something very elegant, very safe, very gentle and pleasant that would help people not only with pain, but also with health, energy, and stress issues. I don't know if that answered the question for you about where
I love all that history. Of course, I love all that history. And those, is at least Dr. Goodhart is certainly one of my mentors. And I too learned some muscle testing even before I went to chiropractic school, which is how I got into chiropractic school. So I always joke around and say that muscle testing is my second language. So it's so useful to be able to have a conversation with the body by way of muscle testing. And when I explain that to my patients, at first it sounds a little funny, but they do understand that the body does know everything about itself, and what we've got to do is figure out what it's trying to say. And muscle testing is the best way that I know how to do that. So regarding assisted self-alignment protocol, or ASAP, which we call it, what makes it different than and so effective?
I think that what makes it so effective is that the body itself is directing the treatment, if you will, or the adjustment in chiropractic terms.
Mhm.
If I'm on the outside, I can approximate the kind of force and the direction of force that I would use to move a vertebra or a pelvic structure or even an extremity bone in the foot. But if the body does it itself, it uses the exact amount of force it needs, which is likely to be a lot less, and to know what kind of sequence to go in, what sort of an order to go in. And with the muscle testing to guide me, I feel a lot safer about it. And I think in the case of many patients, they also like the idea that they can be worked with fully clothed. They can be seated on a table, which is especially important if somebody has certain kinds of conditions that would interfere with breathing or if they're pregnant. Uh, it's just a very comfortable way to get things done, and it doesn't take any longer.
Not at all. In fact, I've been getting
Uh,
excellent results. I wanted to report that to you. I had a patient today who wanted me to pass that along to you, that it's just
oh,
been
wonderful.
absolutely wonderful. And this was a patient who I've been doing the outside, the more forceful adjustments on for many, many years. And she has been getting such great results with this, as have many of my patients. So I think that if maybe we could describe a little bit what it's like to do this kind of treatment or to receive it. And would you like to do that, or shall I?
Why don't you go ahead and
Okay, you correct me if I'm
I'll chime in or wait until you're done.
okay. Sounds good. So what happens is the patient typically sits down. I've done it with people who are lying down also. Most of the time the person sits, and I have them, because logistically it works well, I have them sitting on a chair in my office, and I find a muscle that's nice and strong. Usually it's an arm just outstretched, and I would touch various spots. Most of them are actually on the face. So I might touch a spot here and muscle test. And if the arm stays up, then I go on to the next point. And if the arm goes down, then that point has to do with a particular direction of a particular vertebra's misalignment. So there's also a correction point that Dr. Stuart has somehow figured out, and I will go and rub a point, and it could be, depending upon where the original point was, it could be as simple as a little point right up here, or it could be a little point right over there, or it could be a little point right over here. And I rub it for just about as long as it takes to turn on a light switch, because that's what we're doing. We're turning on those light switches in the body. And then I go back and retest that spot, and somehow the arm stays up. And I test it. Sometimes I'll go to that vertebra, whichever one it was that was misaligned, and I'll check it in the way that I typically have in my 36 years of practice. I might just touch it. And if the arm goes down, then I know that something's out of alignment or something's going on there that the body doesn't quite like. And this gives me a way of rechecking. So if I check it beforehand to correlate with a particular point, then the arm goes down both times, when I touch the point and when I touch the associated vertebra. And then after I just rub a dub dub 3 minutes up, and then there it is. I get the point to both of those points to cause the arm to go strong, and I know I've done my job. And actually, I've told the body what to do, and it does its job. So there are lots of different points like that, and somehow the body gets realigned in its own time. The patient could oftentimes the patient gets results right away that might involve lessening of pain or improving of posture or various other things that they perceive as positive. Sometimes, as the body in its own wisdom goes through shifting as a result of what is actually a very powerful movement in the body, but very subtle, sometimes the person could have a little bit of pain as they would in another kind of adjustment afterwards, as the body is getting used to a new position, and then it gets better. Maybe they need another treatment. Maybe the body has layers that it needs to work through. And it doesn't take very long to go through a lot of points and a lot of a very thorough assessment of the spine and whatever else needs to be done. So I've been having a lot of fun with it, and I feel that this is something that as I get older in my practice, it's a little easier for me to do than the what we call the osseous adjustments, or the adjustments that are more vigorous, that some people are actually nervous about getting. They don't like having the sound of their bones cracking. They think their bones are cracking. Well, their bones aren't cracking. I couldn't do this job if I was cracking bones. But those gas bubbles that are being released from joints that are stuck can make a nice popping sound that chiropractors get a big kick out of. At the same time, it's not necessary now that we have this very gentle method. And some people do prefer to hear that, and that's fine, because we've been doing that a long time and they can still get those kinds of treatments. Oftentimes they figure out that their much more gentle adjustment with ASAP was actually more effective. And that's what I've been finding. So I'm doing this on many, many of my patients and absolutely loving it.
Wonderful.
Yeah, thank you so much. I really appreciate it. How would somebody know that they needed this sort of treatment, Dr. Stuart?
Well, when something is misaligned, a lot of times it's uncomfortable as well as unbalanced. So, for instance, if I were to find myself lying in bed and on my back, and my two ankle bones didn't line up with one another, or it felt like my teeth on one side weren't meeting the same way as the teeth on the other side, that's an indication of an imbalance. If I felt tension in muscles in certain parts of my body, that could also be a clue. Now, this would be equally true if I weren't using this method, but if somebody feels an imbalance, the body is trying to speak another language to tell them something's not quite right here. Can we do something about it? Yeah. Tension, headaches, limping, just feeling a little bit ill at ease, maybe not as strong as usual, could be digestive symptoms. So the same things that respond to traditional chiropractic approaches that are more forceful, I haven't really found anything where this would not work. And often, as I introduce people who've been in my practice longer to this method, I give them a choice and say, well, do you want to try it this way this time? And after a fairly short time, they tend to start self-selecting the less forceful ASAP approach. Has it been that way for you too?
It has been absolutely that way. I could have used those very same words. Yeah, it has. Yep.
What are some of the more dramatic things that you've seen happen?
Well, the really fun thing is when somebody comes in and their back is so sore that they're leaning over and they really have a lot of pain, and then I tell them to get up and walk around a bit, and they look at me like they can't believe it, but their pain is much, much less. So that's wonderful. And I don't know, I wish I could think of them. It's just one thing after another. There's a lot of, I'm really surprised about the lower back issues going away, because it's just so simple. And with chiropractic, we've always worked so hard to get those lumbar spines and those pelvises aligned and the leg lengths the right way and all of those things. And this is just so simple. And the neck pain also. I mean, the most dramatic really is my own story. And when I landed in Houston, I wasn't able to turn my head more than around this, like this. And my neck has always been my trouble spot anyway, because I've kind of trashed it through my life, lots of accidents and various misbehavior. And so I asked Dr. Stuart, even before I came to Houston, whether he'd be willing to work on me, because I was pretty desperate and I didn't have, and the osseous adjustments were not helping me at all. My neck has become rather arthritic through the years. Really, I've had a lot of accidents. And if I didn't have chiropractic, I really don't know what kind of shape I would be in. But at age 66, my neck just doesn't really want to be cranked on in quite the same way. So and it just wasn't working. I have a good chiropractor here. I was getting adjusted, but my neck just couldn't, it wasn't resolving. And when I came to Houston and got in this class, for ASAP, I was then able, after some work, it took us some work, didn't it? It took us some work to get me to the point where I could turn, but now I can turn, and my neck only hurts a little bit at the very top. And should I come to Houston again? Probably. And the lovely thing is, though, that I've been doing muscle testing for so long that I can do some of this work on my own, which I'm very grateful for. So that's really the most dramatic thing, is my very own story. And that was the thing that made me know. I knew, I mean, I've always known that I had this something to learn from you. And I just didn't know what it was or when it would happen. But now I know why I knew to stay in touch with you, other than the fact that I really like you and you're a wonderful, wonderful person. There was really something that I was going to learn. And this is it, because as I go into my later years in my practice, I really do appreciate having something more gentle to do, because chiropractic is not an easy profession. If we're working on people more vigorously, it takes a toll on us. And those of us who, as we get older, I don't know about others, but I know that some people have actually had to retire because of the physical stress. And now I have a very easy way to continue my practice, and I love my practice. I'm not at all interested in retiring or giving it up. And now I have this to do and to help people with. I also wanted to ask you, what is your experience with people having more visceral issues? So you mentioned digestion. In my practice, I treat people, and I know you do too, who have hormonal issues and all sorts of visceral issues. We really are healthcare providers, and so we take care of whole people. We are holistic healthcare providers, and so we need to take care of everything, and as much as we possibly can. Not that we don't appreciate the medical people when we need them, we certainly do, but they often have their gifts have to do with surgery and medication and acute issues, I think, and our gifts have to do with chronic issues and that sort of thing. So would you agree with what I'm saying?
Yes.
There? And what kinds of things have you seen with more visceral issues? And the word visceral, for those of you who don't know, means organ and gland kinds of issues, function.
I've seen very gratifying results with urinary problems, digestive problems, thyroid and pituitary related problems, where temperature regulation, vision, hearing, it's been really nice. And belching, but constipation.
And that's wonderful. And is the mechanism the same as we know through chiropractic, that the nerves from the spine go to all these organs? So if we're aligning spines, then the organs that those nerves go to function better?
Well, I would say the spine and the cranium.
Of course, yes.
We have for those who went through the same kind of school systems that we did and didn't have much exposure to how we're made and what does what in our bodies.
Yeah.
We have cranial nerves and spinal nerves,
yes.
which are the pathways through which our brains and our bodies talk with each other and negotiate these sorts of issues. And excuse me, allergies too.
Yes.
A lot of people say their allergies are better.
Yeah. Well, that's really great to know. And, I've only been doing this now since I think October was when I came to Houston to learn it. And I just jumped right into it and I started working with it immediately. Your teaching was so clear and I really appreciate that. So unfortunately, we've only got a few minutes left here on this Zoom call. Is there anything else that you would like to get across to patients, practitioners, anybody who's interested in learning more about this?
Okay. One of the things that I'm really happy about is the level of safety that anybody, whether they have special problems or not, can take for granted with this approach. Nobody ever got hurt by somebody being more gentle with them. And the people who have severe scoliosis, rods in their spines, cancers, and other conditions. I have had a condition myself where a chiropractor I was very fond of and still am decided he couldn't treat me anymore because I had an aneurysm in my abdominal aorta, and he rightfully concluded that it wasn't safe for him to use a very forceful method to open up the space in my spine. But it just makes things possible for more people. And it works wonderfully on babies and young children, which is nice.
Yeah, that's wonderful. So yeah, I'm so happy that I was able to work with you and that we've stayed in touch. So I don't know if there's anything else. Well, let me just ask you really, I don't know if this is a fast question. We may have to do a whole other one. But how did you develop how did you find out where these points were? Is that something that you can describe, or is that another conversation altogether?
Well, I think that the short version of it is that the muscle testing could also guide me toward finding out what would work there. And for people who have been using it a long time, there are quicker methods of using muscle testing with smaller muscles to rapidly go through many possibilities so that it doesn't take as long as it would with a big arm test.
Mm-hmm.
And
yeah.
But it's just a matter of finding out what works.
Yeah. Well, I'm very grateful for you and your curiosity, and that you've continued all of that, and that you're just who you are.
And your patients are very fortunate to have you in their lives.
Thank you. Thank you so much. I really appreciate that. Dr. Stuart, if anyone's interested around my area, they can go to my website, drlisagordon.com. What about to learn more about ASAP for anybody else? Is there, how would they get in touch with you?
I'm working on a website right now for ASAP.
Okay.
And I have many other projects going on at the same time.
Yeah.
a good way would be to call my office. I can give you my number, or to email me.
Why don't you give your email instead of your phone number?
I
Because
think that'll be easier.
I think that'll be better.
Okay.
It'll be more manageable for you.
All right. My name is Stuart, Stuart. So my practice is head2foot.com. It's head2foot, HEAD, the numeral 2, FOOT. So Dr. Stuart, DrStuart, at head, HEAD, the numeral 2, foot.com.
Thank you very much.
And I'll be glad to answer any inquiries. This technique is open to any healthcare practitioner who has a doctorate level healing arts degree.
Well, the more people who get it, the better off we're going to be, because we're going to be in alignment. Therefore, we'll be healthier, and you're really carrying on the work of the greats who came before us, and I consider you one of them, Dr. Stuart.
Oh, thank you.
Thank you so much for doing this, and I'll look forward to speaking with you again in the near future.